I am Michael Soult. I am a vascular surgeon at Loyola Medicine. As a vascular surgeon, we treat many different diseases across the body, from peripheral artery disease to carotid disease. We help with dialysis access, but I mainly specialize in complex aortic surgery. There's lots of different reasons that you could have a need for aortic surgery. Two biggest ones are aortic dissection, which is when the inner layer of the aorta peels off from that and blood gets on both sides, or aneurysmal disease, meaning the aorta dilates over time and with that becomes thinner and you run the risk of rupture. Aortic disease and aortic pathologies require complex interventions. Because the aorta goes from the level of the heart all the way through the body, that requires a collaboration that we have with the cardiac surgeons and the vascular surgeons to tailor the approach. Whether that be open surgery or using stents and wires and catheters to be able to go through small incisions in the groin, we're a unique center in that we can offer both. There aren't a lot of places that are able to treat the entire aorta with both those options, and that collaboration allows us to tailor the approach to the patient and provide them the best treatment possible. When these patients come in, and I've often been told that they don't have options to be able to treat this, to come to a place that is able to provide them a solution that is only 2 little incisions in their groin and get them back to their life and living the way that they were without the fear of these aneurysms having potential problems down the road, is something that is very gratifying when they come back, and they're very appreciative of all the work that we were able to provide here.